Nisha the PA, we are live.
Hi guys, it's Nisha the PA over here at Dr. Emer's office, and today what we're doing is FRAXEL laser to really help with my clients' acne scars resurfacing them. Now first I want you to kind of take a look at his skin. We just got done doing TCA cross, which is why you see a little bit of this white frosting. We typically do TCA cross to acne or ice pick type scarring, certain types of scar. Now we're doing our FRAXEL laser. That's going to help to resurface the rest of his acne scars that you have. So a lot of these little scarring that you see kind of throughout his cheek, a very consistent treatment of FRAXEL will help to remodel some of those scars. Now, I'm going to go ahead and get started. I already got done doing his forehead. We're now going to get started on his right cheek. Go ahead and fix this. I already set it right over here.
Someone wants to know, is it painful?
Well, he did get a couple of nerve blocks. The FRAXEL can be a little bit spicy. A part of that's going to depend on your pain tolerance. But yes, FRAXEL can be a little bit spicy. We do have things in the office that can help decrease some of that pain and make treatment a lot more tolerable. In this case, we got done doing nerve blocks, which is why you can see he has a little bit of swelling here and here. Give me 1 second, I have to change out.
All right, you guys, this is one of our patients where he's on his journey right now for acne scarring. We started earlier for his first treatment. We did a CO2 and a pixel, which is going to be our ROAR combination treatment. We saw dramatic improvement in the scars for him. He had a lot of tiny ice pick scars that were very deep. And guys, the acne scar is not just a one-time treatment. It's a building process and it's an improvement process. Is this mocks your halo? No, guys, we're doing our FRAXEL laser with Nisha the PA.
Alright, take a treatment. So you can see he has a little bit of swelling that is from the nerve block that we just got done doing. That's helping to decrease some of the pain that's associated with the FRAXEL laser, some of the spiciness. Now,
how do I set up a consultation? I live out of state. You guys can go to a link in our bio, or you can send us a DM, full name, email, phone number. Get your consultation with Dr. Emer, our treatment coordinators, or Nisha the PA.
Guys, I would love to see you guys in office or do a virtual consultation with you. It's super easy. Send in some photos. You can come up with a customized plan just for you. Make sure to take care of you from the start all the way to finish. Now you may look at a scarring and say, well, it's not that bad. Now this is the thing, he's already done a couple of treatments, so he already has a really good improvement. I turn a little to the right, perfect. He already has really good improvement of his acne scars. So what we're trying to do right now is continue to remodel his acne scars. Keep in mind that when we're treating acne, treating texture, that it is going to take consistent treatments to improve. Now he already did a big laser, and now he's continuing with his maintenance plan, which includes a combination of FRAXEL. And remember, we're still resurfacing those acne scars, getting them to produce more collagen, helping them to smooth out.
Someone wants to know, what is the difference between Halo and Moxie? Should you tell them?
Yeah.
Okay.
Let's see if Jordan knows. What's the difference between Halo and Moxie?
All right, guys. So the Moxie,
Pop quiz, Nisha the PA to Jordan.
Nisha will correct me if I'm wrong.
Yes.
But the Moxie is a lower downtime laser. It's good for skin resurfacing, sun damage, any kind of fine lines and wrinkles. The Halo is a it's a hybrid laser. So I was going to have a erbium component in there as well. And that one's, we use that more freely for acne scars. It's going to get more deeper resurfacing. It's going to hit 2 wavelengths at the same time.
Yep. Is it ablative or non-ablative?
It is ablative.
Yeah, so that's one of the other differences between Halo and Moxie is that Halo is an ablative laser. What that means is that we are actually damaging the top layer of skin to get it to smooth out and improve your scarring. Actually, move on to the right side of the cheek. Now, with Halo laser, there is going to be a little bit more of a prep associated with that laser. That's going to help to make sure that we decrease the risk of pigmenting. And then also, there's important skincare that you're going to need to actually heal from all of the lasers, but especially our Halo laser, which is a little bit more aggressive.
Someone's asking, can this be done on skin with more melanin?
You can, absolutely. It's all about the prep, guys. That's one of the big things that we do here. We don't just do lasers. We make sure we prep you accordingly with skincare. Now, in order to make sure you are prepped appropriately, it's super important that you actually have a consultation, virtual and office, so that way we can make sure you have all of the appropriate skincare to make sure you heal from doing something like the halo laser, even when you have more melanin. You're doing really good. Now, when it comes to downtime from a laser like this, it's really going to depend on the intensity that we do and kind of what you're trying to achieve. It can be anywhere between 1 to 3 days or 3 to 5. It really just depends. You're doing really good. I know you're feeling it. We're going to flip back.
Some of you guys with very specific treatment questions, you guys need to send us a DM, full name, email, and phone number. You'll need to have a consultation with each of the PA or Dr. Emer or one of our coordinators.
I would love to have you guys in the office. I would love to talk to you more individually about what skincare or what laser treatments is going to work to help you really achieve your aesthetic goals.
What percentage of improvement can you expect?
I'm sorry, repeat the question one more time.
What percentage improvement can he expect?
Now, it really is going to depend on part of that, remember, will depend on the intensity of kind of the treatment that we're doing. But I recommend anywhere, or I normally say anywhere between like 15% improvement on average. It really just depends on a couple of different factors. Now, of course, when you do combination treatments, combining something like FRAXEL with something like Pixel or Fractura, you're going to get a little bit more improvement. If you're going to combine it with something like TCA Cross, if you have ice pick scarring, of course you're going to get improvement of that as well. So it really just depends on the combination treatment that you're doing and the intensity and downtime you have.
All right, they want to know what location we are at.
Oh my gosh, tell them.
Guys, we're in West Hollywood right now. Tomorrow we're going to be going to New York, and then we'll be in Florida.
Alright, I'm going to go ahead and do the left side of your forehead. Doing really good.
Is he getting a combination treatment? Yes, guys, everything here is a combination. We just did TCA Cross before Dr. Emer came in and did. You can see some of the white spots on the frosting right there. And now we're doing FRAXEL. We started with a bigger laser treatment for him, and now we're maintaining his results and improving them with a lighter laser.
That's right. Now remember, it's going to take multiple treatments. This is not like a one and done type thing. You really have to work on improving your tone and your texture when we're talking about lasers like this. But if you trust the process, we can help you get better texture, better tone, and more clarity with a combination of lasers and skincare. Doing really good. Do you have any other questions for me, Jordan? Now remember, this is the FRAXEL laser. We can use it for two different reasons. We can use it to resurface the skin, treat acne scarring.
Does FRAXEL cause hypo and hyperpigmentation?
Well, any laser can cause hyper or hypopigmentation in the wrong hands. So yes, the answer is yes. But used in the right hands, the way that we do it here, your risk of hyper or hypopigmentation is relatively low. And that's because we take care of you from the very beginning, making sure that we prep your skin with skincare. And then we also tell you the skincare that you're going to need to heal from the lasers, so you minimize your risk of hypo or hyperpigmentation. Remember, these are really hot lasers, guys. So you got to make sure you go to someone that really knows what they're doing. Perfect, perfect. All right. I'm going to go ahead and finish them up off camera, give them a little bit of cooler in the meantime. Remember that we did a combination of TCA Cross, FRAXEL laser. The TCA Cross is more for the ice pick scarring. You guys will be able to see some of the frosting. That's the type of treatment that we recommend for ice pick. Now, of course, depending on what type of acne scars you have, you may need to do either a punch biopsy or subcision and vella film. In this particular case, we did TCA cross. Now the Fractor or the FRAXEL that we use today, this is going to be used to resurface some of his acne scars. You can't quite see it yet, but we're going to resurface some of his acne scars with the FRAXEL laser. The downtime is really going to depend on the intensity of the lasers, but can be anywhere between 1 to 3 days or 3 to 5. And then he's going to heal amazingly because he has all of his skincare that he needs to make sure he heals from his laser, which we give you a full skincare regimen with one of our estheticians, and make sure you understand how to use your product to make sure you can continue to look amazing as this year finishes out. Now remember, we do virtual in-office consultations. I would love to see you here in the office or meet you virtually. You guys know how to get in touch with us, slide in our DMs, first name, last name, email address, and phone number. Until next time, it's Nisha the PA at Dr. Emer's office, and I can't wait to treat you guys in our clinic. Bye guys.